To image the bladder in lateral recumbency, place the probe in the patient's flank, just cranial to the hind limb. Orient the probe in a sagittal plane with the marker toward the patient's head and indicated on the left of the screen. Locate the fluid-filled urinary bladder in the caudal abdomen. Fan the probe up and down until the bladder disappears in both directions to ensure that you've seen it all. If necessary, rock the probe cranial to caudal as well to visualize the apex all the way back to the trigone. The technique is similar in dorsal recumbency. Position the probe in a sagittal orientation over the ventral caudal abdomen and locate the cranial aspect of the bladder. Fan right to left over the extent of the bladder while sliding the probe caudally as needed to visualize the trigone and proximal urethra. Rotate the probe 90 degrees with the marker to the patient's right to examine the bladder in a transverse orientation. Rock or slide the probe left and right once again while moving along the midline to examine the entire length of the organ.